The path that we've been on has evolved. We're doing the right things the right way for our patients and our communities. And technology has to play a huge role in that transformation. We started thinking about telehealth, and so we came up with a solution.
Tele-ICU was one of the solutions to how to manage our broad population of critical care patients across the organization. We really needed the availability of dedicated critical care providers to oversee this most sick and at-risk patient population. However, there was an ongoing critical care physician shortage in the nation. And how do we provide that best level of care consistently, 24 hours a day, and commensurate with the needs of our patients, which, when combined across the system, is a very large population of critical care patients.
Moving this whole healthcare system from volume to value, the only way to do that is to maximize efficiency. And one of the ways that we're doing that is with telehealth. We rolled out the Tele-ICU model.
And Tele-ICU really is cutting-edge technology. It's becoming more and more common, but we were amongst the first and we're amongst the largest, and we've been very successful at it. When we do a point-of-care ultrasound remotely, it's almost as though we're able to reach through the camera and examine the patient and really get an in-depth look as to why the patient is critically ill.
You have literally a room with a view. You can instantly, within seconds, be able to go in virtually in that patient's room, look at that patient, talk to the patient, talk to the patient's family, talk with the bedside nurse. So having a centralized, dedicated critical care team, having the ability for that team to, within seconds, access and communicate with the patient and the caregivers at the bedside in any state in the country, that itself is revolutionary.
When we talk about human beings, wrong turns often equate to puncturing an artery or puncturing a lung, and that's simply not permissible.
They have the ability to improve the patient's condition just by a non-invasive procedure that was done very quickly, very efficiently at the bedside.
Information that we get from a quick handheld sonogram right there at the bedside is incredibly efficient. You know, historically we might get a CT scan, we might call somebody in for, a formal study of some kind. What if we could put that technology right in the hands of the caregivers that are at the patient's bedside?
Ultrasound is a passion. There's nothing really like it in the medicine man's world. For us to be able to see into our patients clearly and attach clinical findings to clinical syndromes and create diagnoses out of them is the holy grail of what we do. The ultrasound program thrives because it's worth more than it costs.
It helps us move from a reactionary care to proactive care.
To be able to walk into a clinical conundrum, evaluate, diagnose, and treat all in a very short period of time is an amazing thing. It's certainly something that has allowed us to move much faster with much less delay.
I'm, ecstatic that we're able to use this amazing tool in a Tele-ICU platform and therefore make it available to critically ill patients who otherwise wouldn't have it available.
With this simple, non-invasive, safe device, we can get so much more information in real time at the point of care than we've ever had before.